The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection. Welcome back, everyone. You're here for another episode of APIC's The 5-Second Rule, and it's episode 29, and we're going to be talking all about ventilation. That's right. There's more to it than just opening your window. I'm Silvia Quevedo, your host, and I'm happy to be joined by one of APIC's finest, Louis Johnson. Louis is an APIC member. Interestingly, he is certified in both industrial hygiene and infection control. He has a Master's of Science in Industrial Health from the University of Michigan, and he works for the Lee Health System in Fort Myers, Florida. There, he's the Interim Director for Environmental Standards. His focus is environmental infection control, including water hygiene and quality, ventilation and filtration, cleaning, disinfection, and pharmacy environments. As I said, he's one of APIC's finest. He's a past member of the APIC Practice Guidance Committee. He is actually a fellow of APIC, and he is a member and past chair of the American Industrial Hygiene Association Healthcare Working Group. And that's just a small smattering of all the great things Louis has done and does. So welcome, Louis.
Thank you, Sylvia. You are too kind, but it has really been a couple of years for ventilation and industrial hygiene, hasn't it?
You know, Louis, truly, you do a lot for APIC, and we're so pleased to have you on the podcast to educate the public and, frankly, other healthcare workers on some really important science behind ventilation. But before we do that, I'm not sure everyone is as familiar with industrial hygiene. I know I wasn't. Only a few years ago did I become familiar with the whole profession. So can you share a little bit about what industrial hygiene is and what industrial hygienists do?
Sure, I'd be happy to. There's actually a lot of overlap between our training and that an infection preventionist have. We look at traditionally workplace environments and look at contamination or injuries to workers in the workplace. These can be chemical, they can be physical injuries, and ventilation, of course, is a big part of that, along with epidemiology and biostatistics to look at the data and sampling and ergonomics and working with workers. And so we've come out of the industrial environment. But of course, this is the post-industrial age. So many of us industrial hygienists are doing other things. My background ended up more towards building contamination and safety. I did a lot of time with indoor air quality investigations, asbestos in buildings, and learned about contamination and control that way before I migrated finally into healthcare, where we find in infection prevention, there's a lot of opportunity for industrial hygiene work.
Wow. So again, that's interesting, sort of the history. I'm thinking like Charles Dickens and, you know, the terrible air of London in the late 1800s, right?
Well, yep, they teach us about that, and we go through those studies. We actually go back to Pliny the Elder in ancient Greece, who found that, I think I know why the people that are digging out all that rock in the mountain are getting sick and dying early, as some of the forerunners. And so there is a long history of industrial hygiene as looking at these hazards, and like I say, it's one of those things that as we move into a less industrial and a more service economy, the industry or the profession has migrated with that.
Wow. So see here at the 5 second rule, it's just, you get a little bit of everything. So Lewis, let's get into it. So talk to us about ventilation and its role in pathogen transmission and mitigation. Obviously, here on the 5 second rule, we cover a lot of topics related to infection prevention and control. And we want to tackle this notion of, air and air movement. So can you give us sort of the elementary version of why that's important and its role?
Sure. I mean, just like with a lot of our controls in healthcare, we're looking to try to go from clean to dirty, to keep the clean things clean and the dirty side dirty. And air can carry some of those contaminants. If we have dust being stirred up in hallways that are not as clean as a patient room, we would want the air to flow from the patient room out into the hallway and then into an air return, rather than bring that crowded, dusty hallway air into patient areas or into procedure rooms. If we are doing cleaning of endoscopes where we may have a lot of yuck on the scope that could become aerosolized or into the air, we want to make sure that we're holding that and exhausting it out rather than letting it flow to where the clean scopes are, or perhaps even to where people are having a procedure done. And so just as we look at traffic flow and we try to keep our traffic flow from clean to dirty, or if we're EVS in a room, environmental cleaning in the room, we would want to clean so that we're going from clean to dirty, so we don't carry the dirty into the clean. We look to do the same sort of thing with ventilation to make sure that we keep the clean areas clean and keep the dirty areas from infringing on those through the airflow through the spaces.
Okay, so that makes sense. Although for me, and I don't know for others, the notion of clean air, meaning, because you mentioned dust, or you mentioned in the endoscope where there may be, I think the highly technical term you used was yuck.
Yeah, yes.
Yuck on the scope can become aerosolized, right? But so that makes sense, and that's super helpful. You're constantly trying to move air with concentrated particles that we don't want out and bring in the fresh air.
Right.
I guess for me, one of the questions is, air is not sterile, right? There's natural microbes circulating. But that's okay, right?
Well, it is. I mean, air is a lot like water, that it's healthy for healthy people. The less healthy you are, the more susceptible you are to an infection, the cleaner, the more sterile, not that it is sterile, but the more disinfected we need that air to be. And so there's things we can do with the air. When it comes into your building, almost all buildings, it goes through at least one filter. Even if we're not worried about protecting the people, we want to make sure the air conditioning coil and the air handler stays clean. So we filter the air to get the debris out of the air, literally the dust, the bird feathers, the seeds and pollen that are floating around out in the air. And we filter that before it even comes through the equipment to keep the equipment clean. In healthcare, it is almost universal that we use two stages of filters. So we have roughing filters to protect the equipment. Then before the air comes out into our procedure rooms or patient areas, we use another bank of filters, a wall of filters that the air blows through. And these filters are more efficient. Efficient means they pull more things out of the air so that we reduce the load of particulate material that is in the air. That holds true not just for things coming from the outside or dirt that gets stirred up, but when people sneeze, when they cough, as they walk around and dead skin cells flake off of them and drift off into the air, those things, as they get pulled up into the air system and it recirculates air through the building and through the air handler, they go through those filters, and those filters remove a great deal of that material out of the air. The amount that gets removed, of course, depends on how efficient, how effective your filters are at grabbing the material, and making sure, of course, your filters aren't leaking or improperly set and having bypassing. If you need even more cleaning, you can do things like running it through a UV light, which will disinfect and kill live organisms that are in the air, and use other treatments to help further disinfect or clean the air.
Okay, so let's talk a little bit about this, because filtration, we've discussed on the podcast a little bit when we talk about PPE, personal protective equipment, whether we're talking about masks or respirators, or even now discussion around gowns. So in construction and renovation and air filtration, are we talking about the size of different particulates? And so I know with the global COVID-19 pandemic, the public has been made aware of some of these issues. Talk to us about what's a HEPA filter, and some of maybe the science around how well those filtrate, is that the verb, filtrate pathogens?
Well, or how efficient they are at trapping the pathogen.
Thank you.
So a HEPA filter is a high efficiency particulate air. So particulate means it's grabbing dust particles or material out of the air. It doesn't get gases out of the air. And so some people think, oh, I'm working with this nasty, smelly stuff. I'm going to put my N95 or my HEPA filtered respirator on. It won't help. It won't trap the gases. It's only designed to trap the particulates. But a HEPA filter that is certified and tested should trap 99.97% of particles 0.03 microns or less. There's the official line. One confusion people has is that they think, oh, but I'm trying to trap particles that are less than 0.03 microns, like viruses that are very small. The HEPA filter won't work. And that's actually not true. When we test a HEPA filter at 0.03 microns, that size is the hardest size for a filter to trap. If a particle's bigger or the particle's smaller, the filter actually traps it better. And so HEPA filters are efficient down even into very small particles. The particles that they have to do for the test are the 0.3 microns, but even 0.2 and 0.1 micron particles get trapped by the HEPA filter, and typically they get trapped better. But HEPA filter is not a well-defined term. There are a lot of people out there selling filters that are made of HEPA material, and that means the material in the filter might be HEPA efficient, but it's not constructed in such a way that it traps all the particles. It may allow bypassing.
Okay, so that's important to know. I've heard of HEPA filters in the context of healthcare settings, but the public is out there and people are concerned. So thank you for that public service announcement. Should they be regulated, HEPA filters? Who sets the standards for those, at least in healthcare?
So the closest we have to a standard in healthcare would be some of the ventilation agencies that set standards for what filtration should look like, and describe the efficiency of the filter collecting. But it really is a little bit of a Wild West free-for-all. The people that control it are the people who are selling the filters. And this is something that we struggle with in environmental infection control. You brought up construction a little bit ago. We often use HEPA filters to filter the construction site to make sure we're pulling the dust so that we're not blowing dust that has construction debris in it out into our healthcare facility. And it's very difficult to tell contractors exactly what they need to get a HEPA filtered blower or a HEPA filtered vacuum, because there are vacuums with HEPA filters advertised for sale that don't meet the requirement of ensuring all the air passes through the filter. So you have to look for things like a certification sticker on the HEPA filter that certifies it was tested, that specific filter was proven to work. You need to look for gaskets that seat the filter in so air can't leak around it. And you need to make sure the filter's not damaged. People might be surprised how many damaged HEPA filters we find when we pull them out of the box.
All right, that's good to know. Talk to us a little bit about air handler design and construction. And I know, Louis, in the past, you've done some presentations where you've talked to infection preventionists, industrial hygienists, and other healthcare workers, because, they're listening to this podcast as well. Some some basic understanding of design, and then also for those of us who sadly may have either had to treat patients or have family members who have an illness that requires them to be in a special room in the hospital with, can you talk to us a little bit about that?
Sure.
Air handler design and construction.
Well, first on the air handler design and construction, I want to put a plug in. My colleague John Martinelli and I will be talking about critical air handler inspections at the APIC conference this spring. And so we hope that people come to hear that to get all the information. But in general, you can get air handlers that are designed to be easy to clean and kept clean inside of them, or you can get very basic, inexpensive air handlers that are less easy to clean. And what I mean by that is some air handlers have double walls. That means there's a layer of metal on the inside, a layer of metal on the outside with the insulation sandwiched between the metal. And so if you get things collecting dirt or you get some contamination growing in the air handler, it's very easy to clean that because you're cleaning off a hard metal surface. You can imagine if you had fiberglass lining on the inside of the air handler and that got dirty, that's very difficult to clean. And so
I'm going to take your word for it because I don't know much about that, but yes.
I assure you that it is. We also have air handlers that now have UV lights built into the inside of the air handler, especially around the air conditioning coils. And these lights are constantly on and are killing any organisms that may get carried into the air handler from the outside air or return air. And if you're in a cooling cycle, if you're using air conditioning, at one point you're going to have 100% humidity of air flowing through that air handler. So it is possible for mold and fungus to grow in an air handler if it's not kept clean. And these UV lights that can be installed in the air handlers do a lot to help control that. So the more critical an air handler is for your healthcare location, the more you want to look to make sure that it is designed to be easy to clean if there's a problem and to prevent buildup or growth of things in the air handler. This is go ahead.
Sorry. Yeah, no, I just wanted to reiterate to our listeners that infection preventionists and the whole infection prevention and control community is looking at products and medical devices that are easy to clean. It's interesting that that's a whole new way of, working with the engineers that produce these things to say, yeah, but at the end of the day, how easy is it to A, determine that it's dirty, and B, clean it. So I think that's an important point.
Yeah, it's also important to make sure the filters are easy to install and that they will be seated and fit properly. It's not uncommon to look at air handlers and see filters that are not fitted into the brackets correctly, so air's bypassing around. You can see the dust trail where the dirt has come through, or the air filters aren't clipped into place properly, so air's whipping around the gaskets on the HEPA filters and bypassing those. And ironically, the more critical an air handler is, the less we tend to look at it. If you think about the air handlers serving your operating room, it's difficult to shut down the air handlers and do an inspection because you've got surgeries going on almost all day long. Other air handlers, it's very easy to shut them down, take a look inside, start them back up. If they're down for a few minutes, it doesn't really matter. And so it is important to consider how you're maintaining and keeping that air handler operating and running. So another thing we talked about was standards. It's common for people to go find one of their reference books or guidebooks and look up and say, well, this is what the current standard says, and then go out and evaluate their spaces based on that current standard. It's important to realize that some of your hospitals or buildings might be 20 or 30 years old and were built by standards that existed, or in some cases did not exist 20 or 30 years ago. And you have to judge the building and its performance by what it was designed to do. This means that air changes in an airborne isolation room may be less in your older building than what they're designed in achieving in newer buildings. Filter efficiencies may be lower, the numbers of filters may be different, but it's important to know when evaluating the system not only what it's doing now, but what it was designed to do at the time it was designed.
So if you're an infection preventionist in an old building, who do you go to? They're working with the engineer who would know this, right?
Right. So you would want to reach out to somebody in and the equivalent of what we call a facilities department. And it's usually the architect will know what code the building was designed under. And if you know what code and standard, and there are lots of them out there, they vary from state to state. I don't want to quote specifics because they'll all be different, but your architect can tell you, here's the standard or law we built the building or designed it under. And then you can go look in the historic documents for those older versions of the standard to see how many air changes it's designed for, the pressure relationships, this sort of thing. There may be times that as an infection preventionist, you decide, even though this is designed to an older standard that at the time was appropriate, this is no longer appropriate for us, and we need to begin a project, and it'll be a capital project because none of this is cheap, to redesign and re-engineer so that we're meeting this new updated current standard.
And we do have a 5-second rule episode on construction and renovation that talks a little bit about that. Let me ask you a little bit. So we're talking about air. And again, if listeners are like me or scrambling to go back to your, high school, oh my God, let me go back to my basic science, right? Pathogens love heat, right? They love moisture. Help us understand the impact that temperature and humidity play in all of this.
Yeah, so the pathogens we tend to worry about the most are the ones that like body temperature, right? If they like 98.6 degrees for growing, that means they're going to grow better inside of us as people. But temperature is a part of it. There's also humidity. Organisms, especially the fungi and the molds, need to have some moisture available in order to grow. And so if we get air outside where it has more moisture than it's able to hold, we get condensation. You've seen that outside with dew on the windows. We get the same thing in buildings. If you drop a temperature very low and there's moisture in the air, that moisture can condense out, and that can promote the growth of mold and fungus in your space. One of the areas that this is a difficult thing to control is, again, back to our ORs, the operating rooms, because surgeons tend to like to have these rooms very, very cold. They're wearing garbs, they're wearing gowns, they're wearing a lot of equipment. And so it's not uncommon to have people chilling these rooms down into the range of 60 degrees. The problem is the colder you make the air, the less moisture it can hold. And so air that's fine at 80 degrees or 75 degrees and has a relative humidity of, let's say, 50%, which is comfortable, if you chill that down to 60 degrees, you're going to condense moisture out, and that could grow mold and be an issue. I'm speaking from Florida where we worry about condensation, but you have the opposite problem up north right now in the winter. And up north, you're heating your air. And so the air's coming in from the outdoors where it's very cold, and that cold air doesn't carry much moisture. Now you heat that 30 or 40 degree air up to 75 degrees, and you have very, very dry air, and you can get relative humidity down to 20%. If you're in a building that has that, you've probably been sparked by the static electricity when you walk across the carpet in the dry air. Some people get nosebleeds from their mucous membranes drying out. You get dry, flaky skin in other people. It's also a fire hazard due to the sparking if you're in surgery and you have electrical equipment going on. And we have problems with materials drying out. So we have to watch our humidity at the low end and the high end of the scale.
Oh, my God, Louis. It's scary stuff.
It's very complicated.
So talk to us about how you manage that in the OR, because obviously hundreds of thousands of successful surgeries are conducted. So how do you manage the temperature, humidity, and pressure issues?
Yeah, so
I think
in ORs, we've been doing this for a long time. By the way, temperature, humidity, pressure, I've got a new favorite acronym starting to go around that we call that thumper now when we're
it sounds like a dating app.
It does, doesn't it? Or a rabbit. But we're starting to get this looked at more by our accrediting agencies. They've looked in the ORs where for years we've had to document that we are meeting those design criteria for humidity and temperature. And we measure that each day to make sure we're achieving it. And we have policies that say what happens if we have an excursion from that. If we have a surgeon that runs it extra cold and the humidity increases, how long can that increase before we have to correct it? If equipment's not keeping up, what do we have to do? Here in Florida, and I assume it's the same in the Southeast, to get those low temperatures and low humidity, we use special chillers that are more akin to the chiller on your refrigerator than on an air handler to super cool the air coming in and get that humidity control we need down at those very low temperatures. What we're starting
Wow.
to see, though, in accreditation, and something people should watch for, is we have other critical areas in healthcare where these thumper, temperature, humidity, and pressure relationships are important. I'm thinking of a sterile storage, where we're storing products that we need to keep clean. So we want clean air flowing into the space and then flowing out to keep dirt from coming in. We have to have humidity control to make sure our products don't get soggy and grow mold or don't become too dry and brittle and not work. And we're seeing inspections of these areas also. So just like with the ORs, these other critical care spaces, it's important to know how are you monitoring and assuring you're maintaining the proper temperature, humidity, and pressure. What do you do if you have an excursion from that and things shift? If your humidity goes up, do you throw everything away from sterile storage? Or are there some products you can reuse? How is that communicated through? This is an area that we're seeing more and more attention from the accrediting agencies.
So, Lewis, what about airplanes? I mean, we hear about air exchange on aircrafts. What can you tell
I
us
want to
about
preface
that?
by saying I've not done specific work in the airline industry on this, but what I have read and what my understanding is that they actually have fairly good filtration in these airplanes, efficient filters that will trap things. Their air changes per hour, the number of times they filter the air in the airplane cabin tends to be on the higher side compared to other spaces. So those are all positives. They're going to be outweighed by if it's a crowded flight and you're sitting next to people who are sniffling and coughing. Even pre-COVID, that was maybe a concern. And remember, the ventilation doesn't do anything for the non-airborne droplet parts of transmission. And so those are still a potential concern. But in general, my understanding is the airplane ventilation is not as bad as other areas could be. Stay away from people as much as you can in the airports and other locations. Wear your mask for source control. Hope the other person's wearing his or her mask, and cross your fingers and go.
Lewis, there's so much here. I mean, we could probably do a whole series of episodes just to talk about, I don't know, humidity.
Yeah.
But and we know that you and others like you are working with your healthcare engineers to ensure that the filters are being managed and cleaned and all that good stuff. But for our listeners who are not in healthcare, so and I'm going to put you on the spot here a little bit. So I'm thinking about, a lot of discussions during the global pandemic with SARS-CoV-2 and the multiple variants that we've experienced. What about ventilation issues in, say, public schools? Any information there? Is it the same? Is it as simple as, can you open a window? Or what does someone at home caring for a loved one who may be ill with COVID or any other respiratory illness, or maybe someone with compromised lungs, talk to us about what are some good recommendations for that population?
Sure. So it is complicated, and sometimes opening a window is the answer. Opening the window works when it's not too cold out, it's not too hot out, it's not too humid out, and it helps if there's a little breeze to move that air through. If you're in a engineered building, an office building or a school, really for most larger schools, if you open windows, you're probably throwing the ventilation off from the mechanical ventilation. And so I'm going to set the home people aside for a second and talk in these other more complicated buildings. Generally, you don't want to open windows because you'll throw the balance of the air handler off. The better answer is to try to get the engineers to bring as much outside air into the air handling system as they can, and then distribute that through the ventilation system to look and see where can we increase the efficiency of our filters. If our filters are, let's say they're an 8 on a scale of 1 to 30, can we go to a more efficient filter that might be a 15 and will trap more things? Ironically, by the way, some people say, oh, we're going to change the filters more often so they filter better. Dirty filters actually filter better than the clean ones because the dirty ones have begun to clog up and have better catching. So as long as
Interesting.
as long as the filters are not interfering with airflow, as long as you have adequate airflow through the system, dirty filters can be your friend. But we had a problem here when we looked to bring outside air in during the COVID period, that we don't have any extra capacity in our system to dehumidify the air. So if we open the outside air and bring more air in or tried to open windows, we'd very quickly have humidity issues. We maybe can do that in the winter time, like this time of year when it's cooler out and dry. But when we're into our July, August, September, October, and the hurricane season, we just can't bring outside air in. Some schools tried to do that, and that created problems for them because of the humidity buildup. You really need to bring extra equipment in to dehumidify the extra outdoor air or increase the amount of filtration you have in the air. So if you move the air through better filters, you get cleaner air, and that can help with the COVID. Going to people who are at home is the same issue, but you've got even less sophisticated equipment probably in your home. The furnace filter that's in your air conditioning or your furnace is really just that, designed to protect the equipment. You can look to see about getting a higher efficiency filter. There's something I know I was told not to use acronyms, but MERV, MERV, the higher that number is on a filter that you buy at the box store or your home supply store, the more efficient it is as a filter. You can keep the fan running on your air conditioning or heater. Most home units cycle on and off. When it's cooling or heating, the fan comes on and blows air. When it's reached temperature, it all shuts down and stops moving air. If you're trying to increase ventilation through your home, there should be a switch called fan, which lets you run the fan all of the time, and that'll move air and keep it running through the filters. But homes don't have a lot of air changes, so if you can open windows, that's helpful. Otherwise, you need to fall back to that social distancing and keeping people that you think are infected in one room and everybody else in other areas of the house.
Wow, this is a lot.
It keeps me busy.
But I do like what you said about the dirty filter is your friend. It made me think of when I go get my oil change and the mechanic always shows me the filter and he says, it's time to get a new filter, which of course costs a lot of money. And I always decline. So now I feel vindicated for that.
Well, as long as you're getting airflow through the filter, that's the other side of it. So I want my engine to breathe well so that it gets plenty of air. But certainly when we're looking at filters on home filtration devices or even at work, just because a filter looks dirty doesn't mean that it's time to change it or there's a problem. And in air handlers, the mechanical people maintaining them usually have a gauge that tells them how much resistance is there in the filter due to the loading. And when that filter gets to the point that it's too loaded, they'll know that it's time to change it out.
Gotcha. Yeah, it is all about airflow. That's the key. Well, I mean, this is my head is blowing up with all this great information, and it is complicated. So I think the community needs to thank you, Louis, and your colleagues in industrial hygiene, and of course, all of our infection preventionists who work closely to ensure that not only your healthcare space, but your schools and other communities are well ventilated to keep those pathogens out. And we will look forward to hearing more about this at the APIC annual conference, which happens in June every year. So if you're a listener and able to attend, we encourage you to do that. For more information about all things infection prevention and control, check out www.apic.org. And again, want to thank Louis Johnson for sharing his expertise on today's episode.
Thanks for listening to the 5-Second Rule, produced by the Association for Professionals in Infection Control and Epidemiology staff and the APIC Communications Committee, in partnership with Human Factor. Audio tech is Blake Alphen.